So, how can we provide more inclusive care for patients with disabilities? That is the topic of today's video and what I wanted to share with you all. So, this is the agenda for today. I wanted to first talk about why and how we should be considering these things, what we should be doing before a patient's visit, and what are things we can do during the encounter to be more accessible to patients with disabilities. And I want to give a shout out to the Greater Los Angeles Agency on Deafness and the Disability Rights Legal Center. We recently had some talks with representatives from these organizations at my medical school, and that was really the impetus for me wanting to talk about what I had learned and to share that with you all. So, why inclusive care? Well, first of all, 1 in 4 Americans lives with a disability that impacts major life activities. That is 25% of people, and that is a huge amount. And yet, what I have experienced when I go to the hospital and in clinic is that a lot of times we are not prepared to provide the care that these patients need. Furthermore, disability-associated healthcare spending accounts for 36% of all healthcare expenditures for adults in the US. That is a third, and that is a disproportionate amount of spending on healthcare for this population. So while it's already extremely common in the general population, it's even more so for people who are coming into the clinic, and that makes complete common sense. And yet I feel like we're really not doing enough to make sure that these people feel welcome when they actually come into the clinic. And finally, this is actually required by the American Disabilities Act. In law, it is required to provide reasonable access and accommodation. And if that is not enough additional motivation for you, then I don't know what is. I also wanted to touch on how to refer to patients because I know that this is a topic that can be a little bit touchy and get people very worried. So I'm just going to speak from what I have learned from people who have disabilities and how they feel like they want these things addressed by their healthcare providers. So first of all, realizing that perceptions of ability are highly individual to each patient and to each person. So really just ask what it is that they prefer. And second of all, when in doubt, always use person first language. And so what does this mean? It means rather than saying, I don't know, like rather than putting the condition first, we are saying the person comes first. And so, for example, saying people with disabilities rather than disabled people. Also, avoiding language that implies pity. Nowadays, I think it's still somewhat common to hear people to say, this person is suffering from X condition, and that's language that we should try to avoid because we don't want to be making value judgments. You know, people can be very happy or very miserable, regardless of how society labels them as disabled or not. And the last thing I wanted to mention is that you will not be perfect. I certainly am not perfect, but the point is to try to improve every day so that you can provide better care. Because ultimately, not being accessible and not being welcoming to our patients impedes the provision of the care that we really want to provide. And I wanted to include here a quote from Stephen Stern, who is a professor at Gettysburg College and has spoken on terminology regarding disabilities. And so I'm going to quote him here. I am learning disabled. I am not differently abled. I have heard the story of a colleague at another institution who, after suffering a stroke, lost his sense of spatial awareness. But after the stroke, he suddenly found that he has computational capacities he had never before possessed. He could do quantitative work he had been incapable of before. This person became differently abled. That is not true of me. And I just wanted to include this because I wanted to share how individuals' experiences can be very different, even coming from, at face value, potentially similar situations, and kind of the logic behind that. So before your patient actually steps into the office, what can we do to make our clinic more accessible? So I'm going to divide this up into 3 different steps. So first of all, making both your physical and your virtual presence more accessible. Second, educating ourselves as providers on how to provide accommodations. And then third, making sure that those accommodations are actually ready and in place in advance. So clinic accessibility. Now, I know for people who are working in large hospitals or healthcare systems, you are not necessarily managing the website yourself, but these are things that are important to keep in mind and to also raise as concerns during meetings if you find that your website is not totally accessible to people who have disabilities. So a couple tips would be one, to use easy to read fonts and font sizes. Two, to ensure that web pages can be read by text-to-speech software and that videos are properly captioned. And this is something that I want to start doing a better job of moving forward in my own videos. And third, to add alternative text for images. And so these are all things that make your website more truly welcoming to people who otherwise might not be able to see your website or navigate your website. And there are a lot of tools now to make this much easier for people. So for example, if you're using WordPress, to choose certain templates that are already geared towards being friendly with people with disabilities, and also just using the text boxes under images to add that alternative text. These are really small touches that make a big difference. Now, in terms of your physical presence, first is to consider having your clinic assessed by a certified access specialist or a CASP. This was one of the major recommendations that was given to us from the DRLC, because this is how you can make sure that things that you might not consider or think about are going to be taken care of for your patients before they come in. So for example, even just the height of sanitizing stations, they should be accessible to people who are in wheelchairs, and you might not realize that if you never had to think about it before. So second, related to that, is to check for proper clearance for assistive devices. So for example, making sure that the patient is able to transfer safely onto the exam table if they are transferring from a wheelchair, or if they have crutches. And obviously also as a provider, asking them if they do want assistance and being able to provide that assistance to them if needed. And third, and I think this is really key and something that was mentioned in talks that I was sitting in, to make the waiting room accessible, because that's really the first point of contact for your patients. And if it goes poorly, can already ruin rapport between you and the patient before you even speak to them. So for example, one suggestion that we were given was to implement a number system for patients who are hard of hearing or are deaf. So something that would look kind of like the image above here, where you have the number called, people know what their number is, and that way they have not only a auditory call, but also a visual that makes it very easy for them. And it was very sad for me to hear of challenges that patients had had where they had checked in and multiple people behind them were actually getting into their appointments before them because they could not hear that the person was calling them, and the staff had not notified the nurse that, hey, this person's not going to be able to hear you. You're going to have to use a slightly different method to make sure that they actually know it's time for them to go in. So related to that, how can we educate ourselves on how we're supposed to provide accommodation? I think a first helpful question is to think about how you will ensure proper communication throughout the visit. With the example that I just mentioned, it's really critical that the staff are aware of the patient's needs. That's just like an obvious first step that we can all take. And second, as another specific example, if you are using video remote interpreting, think about if the Wi-Fi is strong enough to maintain a connection. Are you going to be able to actually have an in-person conversation, or is it going to be extremely laggy and the Wi-Fi really needs to be fixed and addressed by the IT department, who's not going to even know that there's a problem unless you were to bring it up? And then second, can both the patient and interpreter see each other during the entire visit? So for example, with someone who requires ASL, are they actually going to be able to sign to the interpreter, or is the interpreter going to be staring at a wall and it's going to be really a one-way conversation? And the experience and the story that we had learned about regarding this is when a pregnant patient who was deaf had come in for an ultrasound. And typically when you do an ultrasound, you know, and you like take a look at how the fetus is and all that stuff, and you relay that information to the patient, you keep the room dark. But in this case, because she did require an ASL interpreter, she asked if the room could just be lit a little bit so that the interpreter could at least see her signing. And initially, she was rebuffed. And this is, I know, a problem that's not just happening at a personal level, but there can be certain protocols that can be very restrictive and that should be revised in order to accommodate patients who have these needs. And these are just things that people don't think about, and we really just need to address it. So that really segues nicely into this next bit that I want to talk about, which is how are we going to improve our workflow? So obviously there are lots of rules in the hospital, and there are lots of guidelines, and so sometimes those sometimes those are not totally considerate of the diversity in patient population that we have. So, for example, asking, how would this look for patients who use wheelchairs? What resources are available to make this process more accessible? And always remember, you are not alone. And as I had mentioned, this is a legal requirement, so look into what your hospital already has, because I've definitely noticed that a lot of times there might be efforts and there might be resources available, but they're not totally implemented or kind of percolated down into a particular ward. So those are things that we can really easily fix. And secondly, utilizing free resources that are available through local nonprofits, through the CDC. The internet is so useful in this respect. Just Googling resources that are out there and making them accessible to your patients. So finally, let's look at how we're actually going to prepare these accommodations in advance and get down to the nitty-gritty. So first, contact the health insurer at least a week in advance to coordinate services. So for example, Medical actually covers ASL interpreters, and that would need to be coordinated to make sure that that person can be there at the exact date and time and in the right place. And obviously that's not going to happen overnight. So whoever is the appropriate contact person to do that, that should be something that's kind of part of the workflow and is a normal part of how we do things. And then second, check 1 to 2 days in advance to make sure that assistive devices and accessible materials are actually in good working order and in the correct location that they need to be for the visit. This is such a small thing that can really ruin a visit if, oh, we have the VRI, but it's in the ward like all the way across like on the 3rd floor, and so we need to take like 30 minutes for someone to go find it and then bring it over, and then that's really just going to ruin rapport, and it's just not very professional. So third, if accommodations will not be ready in time, communicate this to your patient in advance, and they may wish to reschedule, and that's something that they should be able to do. This is definitely a complaint I've heard in the hospital from multiple patients about the team not communicating to them what is going on. And that just makes people feel very anxious and upset, and that's totally reasonable, right? So we should be doing a better job as professionals to communicate to our patients when things are not going to plan. And I just wanted to include a note here because I've definitely seen this. Per ADA, it is the clinic's responsibility to provide auxiliary aids, including interpreters. Please do not ask patients to bring a family member in to translate. Not only is this a breach of patient privacy, but it can also prevent patients from accessing sensitive services. So, for example, if you have a 15-year-old girl coming in and she happens to be deaf, and you ask her to bring her mom in to interpret, she may not be as comfortable with disclosing things like sexual activity, substance use, mental health challenges that she's having. And even if she is, sometimes there can be a disconnect where the mom may not, for example, want the daughter to be on birth control because she doesn't want her child to be sexually active, whereas the patient herself does want birth control. And that is something that you should be able to provide as a healthcare provider. So those are the kinds of things that we need to be looking out for. Now, let's say you have cleared all that stuff and prepared it all. woo, this is awesome. And we are on to the patient encounter. So what can we do during the encounter to be more welcoming to our patients with disabilities? And I felt like it was really important for me to mention here about the medical versus the social model of disability. So the medical model is one that views disability as an individual defect within a person that must be cured or fixed, whereas the social model views disability as functional limitations and social barriers to full participation in community life. And now, why is it important to even discuss this or bring it up? I think really the main thing is that the focus shifts toward enhancing our daily function in society when we have more of a social lens to disability. And so I think that that is an overall kind of principle to keep in mind that really rings true with the various gains I think that we've been making over the last decades in disability rights. So during the encounter, I think the first thing is to make sure that you are providing equal access to information. And here I'm extrapolating on recommendations that were given through the Office of the Surgeon General and using specific tools that were suggested to us through patient advocates as well as online. So the first thing is to utilize supported decision making. And this is really a fancy term that is basically saying to provide patients with disabilities the tools they need to make their own informed decisions. And so this includes involving their designated supporters who can provide them with additional information and perspective, as well as things like plain language in our written documents so that they can understand it better. And I'm going to include a link to the ACLU FAQ on this topic that I thought was really helpful and gives specific examples. So second, do not assume that patients with disabilities are not physically or sexually active. This goes the same for patients who are older, for example. A lot of times we forget that, people are going to be sexually active or physically active across the lifespan. And in doing so, we are going to neglect to treat anything that might come up related to that activity. And then finally, provide educational materials in the format that your patient needs. So this kind of ties into the preparation part of things, but making sure that, for example, if your patient is blind, that you're going to give them the appropriate kinds of materials that they can actually interact with, rather than giving them just the same printout that you give everyone else that they won't even be able to read. Okay, and finally, I wanted to talk about patient-centered communication. So this is something that I have heard as kind of a gripe of many patients, is that you should really talk to the patient. Do not talk to their family member, to their caregiver, or to their interpreter. And what I mean by this is that if you're asking a question related to the patient, you can ask them directly, make eye contact with them, not be asking their caregiver, oh, would so and so be okay with this, when the patient is there to see you and you're here to see them. So let's have a conversation one-on-one. And then also, when you are speaking to them, do speak at a normal pace. There's really no need to speak excessively slowly, and it can come off as demeaning. So if a patient is deaf or hard of hearing, you can use an appropriate interpreter or supplement with other modalities that are more suited to them. Additionally, use plain language and explain any jargon. This is obvious and goes for all patients, but just a reminder. And then finally, and I think this is something that's very underutilized, but can be such a game changer for patients, is to leverage multiple modalities of communication. So not just speaking or not just, a written like handout that you're going to print out, but videos, diagrams, dictation can be helpful. 3D models can be super helpful for patients so that they can remember and retain information. And finally, I'm going to close with this, which is that inclusive care is patient-centered care. The disabled community represents a large proportion of our patient population, and I think we really should be doing a better job to make them feel welcomed. And not only should they feel welcome, but it is actually our responsibility by law to do so. And finally, there are steps you can take today to make your clinic more accessible to patients with disabilities. And I hope that this video could be kind of a first step towards that to help you with that process. So thanks everyone for watching. I'm really liking this kind of new video format. My socials are here if you would like to explore them further. I am on TikTok and Instagram, and I will have the handles in the description as well for folks. But yeah, so I hope you have a great rest of your day and that this was helpful. Thanks.